Welcome to Facial Plastics Friday. It's Dr. Brace here, and today we're going to start a series on facial fillers. And so what I wanted to start talking about today was lip filler. This is often the introductory place where people will have filler performed. Usually it's a younger woman who wants to enhance their lips. It could be because they have very thin lips congenitally or genetically, or they have good lip structure, they just want to augment it to make it look a little bit more full. And so there's lots of different reasons why people will do lip filler, and depending on what their underlying lip architecture is and what their desire is for their lip to look like, there are different products that I will use. One of the products that I love using is Restylane Kiss. This is part of the Restylane family of fillers, and it's their OBT technology. So that means that it's a softer, more malleable lip filler that when put in the lip, it moves naturally. It's not going to cause a nodule as easily as some of the older Nasha fillers. And so it's a great lip filler that I find is helpful when somebody needs more structure. If someone has a very thin lip and I'm trying to get a little more stiffness, a little bit more lift to build up the structure of their lip, I'll often start with Kiss. The other filler that I really love is a Canadian company, Ravenesse Prolenum, and this Ravenous Ultra is fantastic in lips because it's very, very soft and it's pre-hydrated. One of the issues with lip filler is from the needle poke to the actual hyaluronic acid, there's going to be a lot of swelling. Some of the more hydrophilic fillers, like the Juvederms, will cause a lot of swelling in the lip and have been shown to migrate in some people from the red lip up in here into the philtrum. And so you may have heard it dubbed Moviderm, but it is a filler that has a risk of doing that. I've not found that Ravenous Ultra or Restylane Kiss has anywhere near the same amount of migration, if any at all, but I've also found that in terms of swelling after lip filler, this one has the least amount of swelling. And so this is very, very soft. It's very, very easy to inject. So as an injector, it's an easy syringe to work with. And I love this for giving lips a little bit more plump, a little bit more volume, a little bit more hydration, because it's very soft and natural looking. And basically, I've never had a nodule using Ravenous Ultra, so I love Ravenous Ultra. When you're doing lip filler, or for anyone thinking about doing lip filler, it's good to think about what you want your lips to look like and to look at different injectors and different styles, because there's different ways to do lip filler. Some of the techniques are a lateral technique with a cannula where you go in and you fill the lip from the side. Some other techniques are directly into the mucosa of the lip. I use a different technique where I will do more of a vertical filling to keep the architecture of the lip more natural looking. And so every injector has their own kind of take on lip filler. So some injectors have a style that they like to do for their lips, and they're known for that. And so if you go to them, you'll get that kind of looking lip, and that's great if that's what you want. If you're looking for something a little more natural, you should see an injector that has a bunch of different techniques available to them, and who does a lot of lip filler. I tend to fill lips more on the natural side. If somebody wants really, really big, exaggerated lips, I'm probably not the right person for you to see, because I want your lips to look natural. They can look full and they can look sexy and they can look big, but we want them to still be in the realm of looking natural. And so when I think about lips, I really want to respect the anatomy, and I'm going to show a little picture here of the lip anatomy. And when I'm filling, I'm looking at the different tubercles of the lip, I'm looking at the vermilion borders of the lip, I'm looking at the white roll of the lip, I'm looking at the philtral ridges of the lip, and I'm looking at the actual mucosa of the lip. If somebody has two dominant lower lip tubercles, then one of the discussions I'll have with them is, do you want to keep that look so your lip looks the same, just more augmented, or do you want to have a single tubercle, because we can change the way that looks. For a while on Instagram, there was this fad going around of the keyhole lip, where people would put a string down the middle or a piece of dental floss down the middle of their lip and make this cleft to define the two different tubercles. That's a specific look. Some people love it, some people are indifferent to it, some people hate it. So when you're filling the lip, the injector has a lot of power to change the way your lip looks. Other things I'm looking at and feeling for are your minor salivary glands. These are the little salivary glands on the inside of the upper and lower lip that with filler can swell pretty big and look or feel like a nodule. So it's good to know if you have underlying large minor salivary glands that may be prone to swelling up. So here's an example of a patient of mine whose lips I filled. This was in 2 sessions. So the first session, because she had smaller lips, smaller structure, I used Restylane Kiss to give her more structure, more definition. And then I followed that up in the second session using Ravenous Ultra to just give it more plump. Now that we had the shape that we wanted, we just wanted a little bit more volume. I could have used Kiss again. I could have probably used Ultra for both sessions, but I found the combination of using the 2 of them gives a really natural, very nice looking lip fill without it looking overdone or looking fake. So if you have questions about filler, lip filler or any other filler, send them my way. And everyone have a great Thanksgiving weekend. Enjoy your family time, and we'll see you next week. Bye-bye.